I think the best time to seek help is when it interferes with your life, okay? If something hurts and you're still able to do all the things that you love to do, you're still able to take care of yourself, you're still able to drive, to do the recreational activities you like golfing, or walking or running. If it's just chronic pain that's nagging you and you can still do those things, you probably just need some Tylenol, ibuprofen, give it time, rest it, ice it, that kind of stuff. But when that pain gets to the point where it's really interfering with your ability to maybe even get out of a chair or go up and down stairs or play with your grandkids or go for a walk, go shopping, have a nice dinner, sit on a chair for more than 20 minutes before your hip or your knee is killing you, then it's time to probably take a look and be seen.
If they all came through the specialist first, generally there's a little more discernment on what the right thing to do is from the beginning rather than just straight to PT. A perfect example would be somebody with a rotator cuff tear, something that isn't going to heal on its own. Physical therapy exercises may improve your range of motion if you're stiff, may even slightly improve your symptoms, although more often it aggravates it. But they're certainly not going to fix the problem, and in a rotator cuff tear, a large enough tear will atrophy and retract to the point that it can't be fixable, sometimes in a matter of months. So there's a definite downside to not being evaluated first to find out, with an exam from a specialist and/or an MRI, do I have a surgical problem, or is this something that therapy can address, rather than just straight to the therapy.
Things that I recommend to try on your own before you see your primary care doctor or orthopedic surgeon is things like changing your activities. If an activity hurts when you do it, maybe try and do it a different way and see if that alleviates the pain. Tylenol or acetaminophen, over-the-counter ibuprofen, Aleve, or generic anti-inflammatory medications can really be of benefit. But you got to take them more than just like for 1 or 2 doses. If you're having really bad pain, you got to take them for probably 3 or 4 or 5 doses just to see if is it really going to help. 1 or 2 doses probably isn't going to give you much relief. It takes time for the medication to build up in your system and become effective. So if you only take 1 or 2 doses, it might help for a few minutes or an hour, but then it wears off. Whereas if you kind of keep it in your system for a few days, then it will help alleviate that problem, whatever it is, and maybe keep it at bay.
Whether it's pain that you're experiencing or limitations in function that you have, once you find out what you have, you can make a treatment decision. And sometimes that means surgery. Sometimes that means different options that we have to help improve the pain that may improve your function without surgery. And I think that gives people peace of mind. A lot of times people will come in, they're not sure what's going on, they've been hurting for a while, and some people come in scared. They may have a tumor, they may have cancer. These are low-lying things that they'll have at the back of their minds. Most of these are very routine. Arthritis is something that's very common in our society. And so a lot of times you will come in and you'll have relief that this is what the problem is. Sometimes that's not the problem. Maybe you've got hip pain and it's really coming from your back. And being able to figure some of those types of things out, I think it's important for, again, not only quality of life for people, but once they have information, you can make a decision regarding your care. And a lot of times that can improve your pain and your function.